So we are here with Mr. G.S. Naveen Kumar, Secretary of Health and Family Welfare, Government of Andhra Pradesh. Personally, I am knowing him from last 10 years, and I have seen a lot of officers after several years of service taking their services like a regular government service. But what's special with Mr. G.S. Naveen Kumar is that even after 10 years of knowing him, I can sense, I can smell, and I can see the same level of enthusiasm and the same level of zeal to do things for the benefit of people and how to use modern innovations for the same. First of all, welcome Mr. G.S. Naveen Kumar. Sir, you are holding a very unique and very key responsibility of healthcare sector of the state of Andhra Pradesh. And if somebody follows you on social media, they can see that on various parameters you are taking healthcare to the last mile through various collaborations, various innovations. So before coming to the topic and before starting the discussion on healthcare research and medical innovations, I would like to request you to give us an overview that what kind of initiatives you are taking in the state of Andhra Pradesh in terms of affordable, accessible, and equitable healthcare for all.
Thank you, Kartik. I think I know him for 10 years. We have worked in many forums together. So when it comes to Andhra Pradesh, what we are looking at is to create that comprehensive care. When we talk about the care continuum, so we talk about the entire comprehensive. It's not just you do the treatment part, you do the certain parts of it, right? So when we have to look at the healthcare, we have to look at the entire picture in a way that you serve. And we also strongly believe that the primary healthcare, I think the Andhra Pradesh government has invested heavily on primary healthcare also for that reason. And Andhra is also the leader in digital health and many things. I think I can keep on going on and on about, say, in fact, yesterday somebody was saying you're from a privileged state. I also worked in UP where a lot of new initiatives are being carried forward. It's not just Andhra Pradesh. What I see post-COVID is every single state which is there in this country is moving towards having a robust public health care system. I think that was the biggest lesson we learned from COVID. So it means that the health systems have to be strengthened in a way that it serves the public health care better. I think there's also a huge concern that out-of-pocket expenditure is very high. We need to reduce that. So it means that we need to collaborate with many other operators. That not just the government would be the only player to play forward. So we need innovations to come in big way, digital technologies to come in big way, so that the gaps in the public health infrastructure can be, the last mile delivery could happen. In fact, somebody wrote it today in my LinkedIn saying that the sprinter, right? So we need last mile sprinter also. It means you take your healthcare to level. From there, you need to take that healthcare to that doorsteps. I think that's the way forward. Given that NCD is 65 to 70%, the home care delivery, I think we have one Jivika here who will talk about home care. Home care becomes very important aspect of healthcare. I think when you see the healthcare continuum, it started as a sanatorium model, then you have the hospital model, then you have ambulatory model. Now home care is the future of healthcare. And Andhra Pradesh has also started using family doctor concept, where the doctors would go home, schools, and start doing the preventive care. I think the investment on preventive care has to be high. In fact, I was telling someone that the healthcare should look at a model where we are not looking at putting an extra hospital. We should be looking at how to reduce one hospital. That is the way forward. I think Andhra government is working on those lines.
Right. Sir, when you talk about medical education and healthcare research, how important are medical innovations, and how do you see promoting more and more medical innovations, maybe in terms of data infrastructure or bringing more transparency in the healthcare ecosystem of the state? So what are your views on that?
See, what has happened is, why we should also think, why did we not have so much of medical innovation or medical research in this country? It is a simple reason that lack of EMR or EHR, whatever you call. Whoever was capable of putting those records together was able to produce very good papers. In fact, if you go to the Voluntary Health Society in Chennai, which is also lead center for research in HIV/AIDS, I think there is a Professor Kumar, he is also a doctor. They were able to do because they were able to put a very strong EMR system. What is NHA doing right now is to create that kind of an infrastructure. See, when you talk about digital health and the government talking about digital health, it's not just putting those records and making it available for the patient. It means many, many things. One of them would be that these records, see, if I talk to you a crowd like this, I would not know how many of you would know that have palpitations when you have coffee, right? So there is no research done on it. Why is it happening? So when research, there's a time lag, or when your research happens, there's a time lag between what really happens and what the research finishes. So the EHR would give you a real-time understanding of what is the evolving diseases which are coming, emerging diseases which are coming, the patterns which would come. These were happening. In fact, there is also a department within the government called epidemiology department, which is supposed to do all this. But the scale at which we are catering to the people, we are not able to do the way we are supposed to do. So what EHR, all these applications would do is, these records would be, we can mask them the way the privacies are protected, but it would create personas, or the way the Instagram creates persona. And it will tell us, these are the emerging patterns of diseases. And we also can find, this would also benefit the pharma industry, the innovation industry, the AI industry. We also talk about Medtech. All this industry would benefit from this kind of knowledge. They can create applications. In fact, I have a simple case study where we can put digital ECG in the rural tribal district where the cardiologist would not be available to test that patient, right? So the digital ECG would come to a machine, and the machine could read and tell only these thousands of ECG can come, only 10, 20 could be picked by that machine and tell us, okay, these are the records which should go to that cardiologist to be seen. We reduce that entire timeline. This is the way we can look forward. In fact, we can also use robotic loop to read records and find out what is the pattern. We are also seeing CKDs, chronic kidney diseases, which are there prevalent because of the pollution. I think somebody was speaking about pollution in the morning. So these are the things which we can look at. And this gives you the larger landscape. When you go to a doctor, when you go to an individual treatment, we are only looking at one patient at a time, right? So, but public healthcare means we have to look at the larger landscape to find solutions. I think, Kartik, the digital technology is the last mile enabler, which will fill in the gaps between what we do not have in terms of the HR, the infrastructure and all. This would fill in those gaps with innovations.
So we all have seen this COVID pandemic recently. So do you think post-COVID pandemic there has been more emphasis on digital health? And have you seen more dimensions being added to digital health specifically?
Yeah, so I always tell this one. When you talk about digital technology, I think health was the last one to pick. So we have been, I think the reason we know each other is we have worked in land records reform. We also seen modernization of the railways. A lot of things have happened because of the digital health. Somehow in the digital technology, but somehow digital health has not picked up. I think somehow it was forced, or people were pushed to digital health during the pandemic. And now I think everyone it's more of a necessity than a privilege anymore. So you need to pick. I think this transformation which has happened, I think it is going to stay. And I'm very sure that's where the future looks like.
Definitely, and I think this country, India, is now a country of a lot of unicorns, and there are a lot of ideas, innovators, startups are there, and you keep talking to them. I can see you. I follow you on social media. So, is there a need of more and more collaboration with the healthcare innovators, healthcare startups, those who have great ideas to monitor the healthcare ecosystem and to bringing more agility in the healthcare ecosystem of the country. So what are your views on these healthcare startups and the healthcare innovation companies?
See, if you see, most of our unicorns were from EdTech, and I think cosmetics also did. I think if you talk about healthcare startups, I think the next decade is for the Medtech startups. I think there's plenty of opportunity. Imagine we have 10 million records EHR available only in Andhra Pradesh. And if you look at the entire landscape, there are so many records which are available. There are so many, I won't call it an industry, it's a market which is going to stay for a longer time. And I'm using an economic term called market, but it's also a place the country is going to grow. Like the way EdTech has grown, I think Medtech would be the one which would, the future of I think we just met a guy who was showing us how can we use speech to record to make sure that the records are available. These are the smaller players. I think there are a lot of smaller players who would come in. in case there is no scale, I think smaller players would make a huge difference in localizing the solutions and trying to build that kind of an ecosystem to solve the problems in fact when we were talking about we were trying to put up a Medtech challenge. So one is that we already have an ABDM platform. Can we put those ready-made solutions which are there with you to on ABD platform? That's the first stage of looking at a Medtech challenge, right? So the second stage would be that there are solutions available, but they are expensive. So can we indigenize them or make in India to make it better? So this is the second stage. We can also look at problems, right? When you look at a lot of problems which are there, the doctor might not know this can be solved using a technology. For example, the robotic surgery, which is getting famous now. And in fact, there's a guy who has left a big company. I remember, what is that company? There's a big company. He has left that big company and come to a smaller company and opened his own robotic surgery wing, which 200 doctors somewhere in North India. And he's making better robotic surgery machines than the original Da Vinci. I think Da Vinci is the machine which is available. So there are people who are, collaborating. And this would mean that the way we look at, there are problems to solve. So are we, getting exposure to those problems? That's a way forward. I think we have enough opportunity in the next, couple of years. And I definitely see Medtech to be the next decade of unicorns.
Right. So apart from these collaboration with industry stakeholders, the existing healthcare force which you have in your state, do you think there's an importance of developing their skills and training them better to provide better healthcare services?
Yes, I always talk about this. We look at infrastructure as one hardware, right? I'm an engineer, so we look at doctors, the hospitals, and the medicines are the hardware part of the ecosystem, the health ecosystem. Capacity and capacity building becomes a very, very crucial role in that. That's what I call myself as the software part of the health ecosystem. That is very important to create, which means that we need to continuously do it. In fact, how did we respond to the COVID management? We learned a lot of protocols which were coming. The way we disseminated to the last mile, right? That was able to give us the results which we were looking forward. And I think it's this continuous capacity building. Doctors who have studied, MBBS or in their own specialization 10 years back, they do it. They do it at what? They do it at a conference level. They do it at a workshop level. But the scale at which we need to, roll it out, the emerging, in fact, yesterday somebody was talking about the emerging post-COVID complications. I think we need to, strongly build capacity, in a very robust way. I would put it in a robust way to the last doctor. In fact, mental health would be a larger problem, right? So we cannot create so many psychologists, so many psychiatrists. Why can't we have primary doctors doing some basic programs and mental health programs? So this would mean that we suddenly have 1,500 doctors who can actually at least understand what is the basic cancer or basic mental health care. Similarly, we are also looking at, imagine there is, if you look at a state like Andhra Pradesh, at least a lakh of patient or approaching a public health doctor on a daily basis. I'm talking about on a daily basis. If this doctor is educated on basic cancer care, mental health, we can actually change over the system. And so we call it global screening program for cancer. We have tried this thing. In fact, we picked up in the Guntur Medical College where we had put some students, nursing students, to ask this question to the people who are waiting there. From the people who are waiting, we did it for a month. We were able to pick 3 or 4 cancer patients who were waiting as an attender, not even as a patient. So this is the scale which we are looking at. So we can actually scale up when we do very good capacity building.
So you are quite ambitious about comprehensive cancer care facilities in the state. I can see in your speeches and your articles. So what are you doing specifically for cancer care in the state of Andhra Pradesh?
So what we look at Andhra Pradesh is we have spent about 575 crores in the last year only for cancer care through the Arogeshri, which is around 400 crores, and 175 crores from the relief fund. So what has happened is, imagine 575 crores just going for cancer care alone. And we treat about 1.5 lakh patients or something. And we talk about treatments. And there are about 60 to 70,000 patients. I'm talking about a big gap because we do not have a registry, so we do not know whether these numbers, what is the exact number, right? So, and we are measuring about 35,000 deaths every single year. So given this problem, so how do we solve it? So which means we need to build that entire, comprehensive cancer care. 70% of your patients who are coming for cancer care are already in their advanced stage. So which means that we need to educate them in the early stages. So which means that we can also save lives, right? So that's more important. And second part is, given this kind of numbers, we need to build that entire continuum, which is prevention, treatment, and also palliative care. I think that's the most forgotten part of the cancer care. We do not see the pain and palliative care as the important person. I'm told 45%, this is a WHO number, 45% of the palliative care is needed for all deaths. I'm talking about all deaths. Palliative care is needed for 45% of the palliative care is needed for all deaths. So which means that we need to build strong palliative care systems, home care systems to build this one. So what we are talking about is the Andhra model, where states like Tamil Nadu, Kerala has done something in advance. So we are looking at 50-kilometer radius where a basic cancer care is available. Because there's also, if you look at one single cancer patient's journey, it's about 26 visits to a cancer facility. At least 26 visits to a cancer facility, which means that if you do not put a facility within 50-kilometer radius, this lady or the guy would be going 200 kilometers, 300 kilometers. Just think about where you are. Your nearest cancer, if you're not living in a big city, your nearest cancer facility within a state would be at least 100 kilometers, 150 kilometers away. So we are looking at least putting a preventive care, chemotherapy, and basic palliative care within the 50-kilometer radius so that they could approach public health care and get this. So what we call this as Andhra model. We are also looking at 10% of our Andhra patients go outside Andhra to get treatment. So we are also looking at stopping this 10%. So we are also looking at building Tirupati as a hub of cancer research also. It's not just cancer treatment. We are also looking at building Tirupati as the hub for cancer research. So these are in line, what we call as the comprehensive cancer care approach of Andhra Pradesh, which is popularly called the Andhra model of cancer care.
Right, you're talking about Tirupati. So I think you are also looking at Tirupati as a medical education hub. So you were talking about it somewhere. So tell us about your plans to, because Tirupati is also internationally acclaimed a tourism place. So your plans for Tirupati to make it a medical education and research hub.
So if you look at Tirupati, Tirupati is one place where we have an IIT. We have an ISAR, which is also an IIT for science and technology. We also have an Sri Venkateswara Medical University for medicine. We also have another medical college, which is called SVRR. It also has an agriculture university. It also has an veterinary university. We have Apollo Medical University there, and Kriya University, and IIT Sri City, which is all in 50-kilometer radius. I don't think any other place in this country which has all this institution. We only miss an IIM there, right? So it becomes a natural, I think it's a natural innovation hub. So what we are doing is we are trying to collaborate or synergize all these institutions within Tirupati to build it into a stronger medical research and innovation hub. So we are also looking at collaborators who would come and set up their parks either in IIT, or we can also do a plug and play park, which we are, I think in the first week of December, we are going to have a roundtable of innovators who would come to Tirupati and to discuss all these collaborations. Given Tirupati, we also would get a lot of interest from the NRAs, which are non-resident Andhras who are there in USA. So there is a lot of interest even by the API, the American Association for Physicians from India, to invest in Tirupati as a medical research hub. And given its proximity to Chennai, I think it's also, I think I would bet on Tirupati becoming a medical innovation hub.
Right. So finally, I would like to ask you that what are the opportunities for, of collaborations? What collaboration opportunities do you see maybe with industry? How can, more and more healthcare investment happen in the state? Have you thought about it? Any plans for it?
See, we also promoted this concept called public health hubs. In fact, we are ready to give lands to people who wants to set up their hospital within the state, and the land will be given free of cost. That is a health hub project which we have. I see the way forward is only collaboration. You can't expect government to do everything at one go, right? So, given the resources and given the constraints, and given the emerging, the public health care problems, we need to collaborate immediately. I think that's the way forward. The reason we won the COVID is that we were able to collaborate. I would not call it PPP, but we were able to successfully collaborate with the private partners to give a successful role or emerge as an public health care. In fact, Andhra has the lowest mortality rate during COVID. So we were able to collaborate quickly with the private partners to give results. So I think it's also a strong message which we already have. we will take this, message forward to, collaborate with people and make it successful as a stronger medical system or health system inside the country.
Right. So there are a lot of industry stakeholders are sitting in the audience as well, and we have not more than 5 minutes with us now. And you heard about the ideas and vision of Mr. G.S. Naveen Kumar with a very important state of India, which is Andhra Pradesh. So a couple of questions we can take if somebody has any questions to ask, please. Can you give them the mic?
Hi. It's a very good discussion.
Be a bit louder, please, and introduce yourself and ask the question, please.
My name is Dr. Rao. I am from Guntur, so Andhra Pradesh. So actually I studied my education and I practiced almost 10 years in the US. After that I came to Guntur and started a neurosciences institute, which is far better than any other institutes in Andhra or Telangana. So what I would like to ask you is like 3 questions. One is digitalization and electronic health records, what you spoke about in this. I will never get a chance to meet you and ask you personally. So that's why I'm asking in this forum. And the second thing.
Talk to me, I'm the most approachable officer.
Yeah, but it might not be so easy in this system. And the second thing is digital health. Like what is we are seeing actually in Andhra Pradesh, the digital health is.
I'm not able to hear you properly at all.
He's asking that what is the scenario of digital health
Digital
in Andhra
health
Pradesh?
in Andhra Pradesh.
I did answer you. I think I told you that we are the leaders in the country with
Yeah,
the 34 million ABA IDs and 1,700 institutions are on the digital roadmap, which means that all the GH, in fact, we have launched Skip the Queue today. I think probably you should visit one of our public facilities to see what we are doing. All our doctors in the public healthcare has a doctor care app, which is an in-house built app. So 1,600 facilities, which means that your urban centers, also the primary health centers. The only places which we are not done is the community health centers. We are thinking whether we should roll out with NIC or we should do it with doctor care, because given the load, because there are CSCs which have stronger load. In the PHCs that doesn't have that kind of load, so we are not able to decide. So in a couple of months, we will be able to do it in the 175 CSCs also.
Okay. So
Any
my
other
question is exactly different. So regarding to the electronic health records, you said almost like 1 million of electronic health records.
1 CR, 10 million.
Yeah, 10 million. So may I know like
No, I'm not able to understand your question.
I mean the places. Is it a private setup or public setup?
It's a public setup. We are government, right?
Yeah, it's a public setup. So next question, if
Okay.
anybody
It
has.
is there in your dashboard. You can log in into ABDM dashboard and see it for yourself if you don't believe it. There is an ABM dashboard
Not able
there.
to believe in.
There
Yeah,
you
it is
please.
there.
Yeah.
I'm knowing it. Thank you.
Hello. Hi, sir. This is Alok Grover. I am the representative of CIPLA over here. You said about collaboration. You said about, hi, am I here? Last.
Yeah.
You said about collaboration with the industry. You said about oncology spend which you have done as a government. I just wanted to know which are the disease areas you are focusing on, so that if from the industry anybody wants to reach you, which are the disease areas you are focusing on?
No, primarily it's NCD, but we are not even. We are also looking at that smaller diseases like CKD and all. We are also have some regional places where, due to certain, I think Uddanam project, we call it Uddanam project, which is there in Andhra Pradesh, which also looks at CKD. In fact, if you look at the northern Andhra, we are also setting up a kidney specialist institute for kidney somewhere in Paderu, in the tribal area. So we are looking at, we do not know. For example, if you talk about oncology, cancer alone, the northern Andhra has more oral cancers. The central Andhra, which has more GI cancers. So we do not know why these are happening, right? So only when you have very strong EHR and when you have very strong, in fact, we are also tying up with NCDIR to do this cancer atlas to understand why these diseases are there in particular area. That could be as simple as a small behavioral change could start reducing that disease. In fact, if you talk about Northeast, they are talking about, not just smoking that meat could reduce the number of cancers, right? So similarly, we can also look at this thing. So NCD would be the largest burden. We are also open to other things. I think we are all open to newer things which we would not know, but technologies would be available for it.
Right. So this will be the last question, and so quickly because he has to leave.
Okay, I am Dr. A.K. Gupta, Director AKG OVM. My question is being,
You're not audible, sir.
hello,
Yeah.
is it okay? I am Dr. A.K. Gupta, Director AKG OVM. My question would be, like we have been talking about so much of, collaboration and all that, but we have not talked about anything about the integration. Because the integration is the need of the hour with, medical systems of various kind, which includes allopathy, homeopathy, Ayurveda and yoga, etc., which is going to be can give a very comprehensive and very effective treatment to all kind of patients. Whether it be, cancer, be it other things also, like, we've been talking about CKD, other patients also. These cases have been given very good results. And if the medical education, as we've been talking about, the syllabus, they teach some part of, all the system, the doctor would be very much aware of the benefits of each other system rather than just negating it because of their ignorance or their high-headedness. Ultimately, it is a patient who suffers because of this ignorance. If this kind of criteria has been taken at the, undergraduate level, so the doctor who passed out, he knows what system is better at which particular place, and without wasting any time, a referral can be given. And above all, if this thing goes to the remotest area, the village area, where the primary health is not being taken care of, the graduates of other sciences, they can take up this particular challenge, and the basic aim of providing health to each and every one of the country can be achieved very nicely. Thank you.
Yeah, I completely agree with you. In fact, if you see the if you see the department itself, it's not just family welfare department. It also includes Ayush. It also includes medical education, which means we have only one single department in Andhra Pradesh which looks after all three. When you talked about, I talked about cancer care, right? We are also looking at how yoga can improve cancer patients. Sure. In fact, mental health, we have made it as an integral part, yoga as an integrated part. We would not, I personally believe, I'm talking about personal level, I strongly believe that Ayush is our own strength. We should not spare it and we'll leave it for other people. So for wellness, I think Ayush should be a very, very good strength. Even for PCC, which I talked about, post-COVID complication, Ayush is going to be the one which will solve all this problem. So we are completely in know of what you are trying to tell us. We will integrate. In fact, mental health, we are integrating, cancer care, we are integrating. For other things also, I think I agree with you on this one. Our own wisdom should be used, into the health system. So we'll also use that to strengthen our health system. Thank you.
Right. Thank you. Thank you so much for the question. I think we'll take it offline. We'll have to close the session. He's here. We'll take it offline. We're running out of time. It was a wonderful discussion. We got to know about the healthcare initiatives happening in Andhra Pradesh, and also in general, your views are, I think, very important for the healthcare ecosystem all over. So it was a great interaction with you, sir. It's always great interacting with you. Thank you so much for joining us. And he's there in the premises. You can connect with him and. After half an hour. So thank you so much for joining us here. And here we wrap up this wonderful interaction with Mr. G.S. Naveen Kumar.